Hi, I'm Dr. Maia. I'm a plastic surgeon in Washington, D.C. area. Let's talk about fat grafting. Most patients during the consultation, they're worried about looking overdone or too puffy. And I'll tell you, do not worry about that. Fat grafting can be highly customized. I can place tiny little amounts and just contour the face in a beautiful way.
So fat grafting is a great procedure. You're asking about what to do. Fat grafting does a lot of beautiful things for the face. We can fill this hollowness here on the face, the infraorbital rim here, and also you can see she has some flattening here on her cheeks that happens with aging. You start seeing the folds a little bit more. So when you do a facelift, what I do, I put a tiny little bit of fat here to help with these folds. Importantly, when we look at this area here, you can see that deficiency. So it's called the prejal sulcus there. So you can see how much tissue deficiency she has there. So tiny bit of fat here goes a long way. The beauty of fat is they're living cells and it brings some stem cells, so it's like regenerative for the skin, so you get that nice skin glow.
That sounds more natural than the filler.
Yeah, so that's the beauty of fat. This is the amount of fat that I need. So I take about 10 to 20 cc's of fat from the tummy, and then we transfer to these tiny little syringes, and then in a very artistic way we put tiny little amounts there, and it just looks beautiful.
If you look at the before and after pictures on my website, you can see restoration of volume with fat grafting, especially on the cheeks, chin, temple area, and sometimes earlobe. Fat grafting is the best way to restore volume in the face, better than fillers. They're your own cells that bring stem cells to the area and rejuvenate the area like nothing else. It can help contour your face in combination with a facelift or isolated, awake under local anesthesia in the office. Fat grafting is usually used in younger patients with early signs of aging. However, if you have sagging skin and skin laxity, you might want to consider facelift. For facelift patients, I usually recommend that because facelift only lifts the face but does not restore volume. So in combination with fat grafting, I also like to do Nanofat, but there's no fat in Nanofat.
This is the consistency of Nanofat. There's no fat in Nanofat. It's just stem cells.
We process the fat to tiny little particles for patients that have dark circles, acne scars, fine lines, and also want to improve the skin texture. We do stamping where we put Nanofat all over the face, and I see major improvements in skin quality. We also can combine this procedure with skin treatments at the same time. You can do CO2 laser, microneedling, and other procedures. Each treatment is customized for each patient, concerns, and desires. That's why it's important to have a consultation with me and my team. We'll discuss everything in details, and then we'll make a tailored approach for you. Remember, Nanofat does not improve volume. We need a larger particle, which is fat grafting. If you have any questions about this procedure, we'll discuss that during your consultation.